right? So once you formulated your review question and decided what outcomes you're interested in, the next step is to construct your PICO. And this represents a major challenge in some ways. Obviously, adverse events data is potentially available from any study that fulfills the participant, intervention, and comparator criteria that are the essential foundation of any review. The only difference between that and the benefit review is that the outcomes you're interested in are different. You're interested in adverse effect outcomes rather than beneficial outcomes. But the participants, interventions, and comparators could be the same. And that's well and good. That allows you to directly compare the benefit versus harm, but creates challenges if the studies that reported benefit outcomes are different from those that report the harms, and you end up doing separate meta-analysis with separate studies in them. So that creates a challenge which is difficult to overcome. And the second point that I like to make is that adverse effects data are available in diverse participants that are not necessarily covered in single reviews. So a drug such as aspirin is used in a large variety of conditions, headache, stroke, heart attacks. And the benefit review may only be looking at one group of participants, for example, aspirin and stroke. And we would therefore miss out the problems of aspirin in patients with heart attacks. And some people may argue that the gastric adverse effects of aspirin are the same, whether you're looking at the stroke population or heart attack population. And so some groups may consider separate reviews covering aspirin in different populations. So that's the participant intervention and comparators. Study designs is a major sticking point. We frequently have questions as to whether we should simply include RCTs or whether we can broaden selection to non-randomized designs. And the simple answer to that is that it depends on what I said right at the beginning. What are the types of adverse effect outcomes that you're interested in? And let me give you an example now. So let's say I'm worried about osteoporosis tablets and adverse events. So if I'm interested in nausea and stomach pain after taking the tablet, that might be easily discovered in trials. If I'm interested in a serious rare complication known as osteonecrosis of the jaw, where perhaps the frequency is less than 1 in 1,000, then perhaps a trial of 200 patients may not be very helpful in identifying the adverse event. And that is certainly true as well if you're looking for something strange like atypical bone fractures that occur after 10 years of treatment. So a 1-year study or 2-year trial may not be sufficient to help us evaluate that particular adverse effect. So knowing what adverse effects you are interested in from the beginning will help you determine what type of study you should be trying to include in your systematic review. And this is fine if you know what outcomes you're interested in. For broad sweep exploratory reviews or diverse adverse events, then it's very difficult to determine what design is most suitable. And there's no easy solution for that. So just to sum up that that situation. So in general, randomized controlled trials are more suited for adverse outcomes that are predictable, well-defined, or well-recognized. They have good chance of being measured. They, if they have high background incidence or common background incidence, then it's likely to be picked up in RCT. And certainly, if they occur soon after starting treatment, then they're likely to be measured. Even if the RCT is only a few weeks long or a few months long, they've a good chance of picking that up. What about observational designs? Now, typically these are based on databases of patients. So this could be insurance claims databases in the United States. In the UK, there's the clinical practice research data link, which is captures data from millions of patients in general practices. And these have the advantage of being suitable for adverse events that are unexpected or not predicted in trials. They could be used for adverse events that have a low background incidence or require longer term follow-up. So this question sort of relates to what type of adverse outcomes you're interested in. And based on your knowledge of the adverse outcome, you can choose the study design of interest. So I'm not going to cover searching and data sources today, but this is a common question. How far should I search beyond the typical database? Methods research that we conducted show that there's substantial missing data if you rely only on published sources. And if you are able to access unpublished sources, there's a huge amount of data that we haven't previously been able to look at. And if you have specific adverse effects outcomes in mind, then it's probably worth your while to capture those in unpublished data. So this will be covered in a separate webinar that's on May the 25th.